All right, let's have a grown-up conversation about diabetes complications. We all know the usual suspects your doctor nags you about. Kidney crap, eye problems that make you see psychedelic light shows, and nerve damage that turns your feet into useless blocks of wood. It's a real party. But today, we're diving into the VIP section of diabetic horrors. The backstage pass to a complication so rare, so brutally bizarre, that most doctors have only seen it in a textbook they used as a coaster in med school. We're talking about diabetic myonecrosis. Sounds fancy, right? Let me translate. It's when your muscle tissue decides to throw in the towel and die overnight, leading to a swelling so spectacular your thigh can suddenly rival a prize-winning Thanksgiving turkey. This isn't your average "I ate too much cake" diabetes story. This is about how years of treating your body like a garbage disposal can trigger a biological backstab that mimics a heart attack, but instead of hitting your ticker, it decides to nuke the big muscles in your legs or arms. With fewer than 200 cases ever written down since they discovered it back when people smoked in hospitals, diabetic myonecrosis is diabetes' most mysterious, hardcore, and frankly badass complication. It's the silent but violent type. Meet Marcus. He's 48, and for the last 15 years he's been treating his type 2 diabetes with the kind of management style you'd expect from a teenager cleaning their room: sheer denial. His HbA1c, that's the 3-month average of your blood sugar, was a staggering 18.2%. For context, normal is under 5.7%. For diabetics, anything over 10% is basically like using corn syrup for blood. Marcus was playing life on expert mode. So Marcus wakes up one morning feeling like someone took a sledgehammer to his right thigh. No fall, no awkward gym session, no angry badger, just pure unadulterated pain. What started as a "maybe I slept on it" funny moment escalated into a full-blown biological crisis faster than you can say, "I should have skipped the third helping of pasta." Within 24 hours, Marcus's right thigh underwent a transformation worthy of a body horror movie. It swelled up, gaining a full 5 inches in circumference compared to its less dramatic twin. The pain wasn't just a dull ache, it was a deep, crushing agony. Like his leg was being used as a stress ball by a giant. The real kicker? No fever, no redness, no sign of infection. It was just a suddenly monstrous, painful leg. When he finally hobbled into the ER, probably scaring the hell out of everyone in the waiting room, the blood tests came back wild. His muscle enzymes were through the roof, the same thing that happens when someone's having a heart attack. But this wasn't his heart. This was his leg. The docs were scratching their heads so hard they were risking bald spots. Then they did the scans. The MRI revealed the brutal truth. Large sections of the quad muscle in his thigh were straight up dead. Deceased. No longer pining for the fjords. It had kicked the bucket. Marcus had developed diabetic myonecrosis, a condition so rare the medical team probably had a group chat going called "Holy crap, is this really happening?" So, what the hell is diabetic myonecrosis? Diabetic myonecrosis, also known as diabetic muscle infarction for the fancy folks, is the spontaneous, unannounced death of skeletal muscle tissue in people who have long-term, poorly controlled diabetes. Let's break down the name like we're in a biker bar. Myo means muscle. Necrosis means it's dead as a doornail. It's a muscle heart attack. Discovered back in the 60s, this condition is the unicorn of diabetes problems. But if you're the unlucky sod who catches this unicorn, it's less about rainbows and more about a permanent limp. It typically goes for the big muscle groups: thighs, calves, sometimes arms. It's not picky. The real danger here is that it's a master of disguise. That sudden, severe pain and swelling can look exactly like a blood clot, a nasty infection, or compartment syndrome. Most patients get misdiagnosed at first, pumped full of antibiotics for an infection that isn't there, while their muscle is quietly committing suicide. This isn't some surface-level ouchie. This is full-thickness, tissue-scorched earth muscle death. In the worst cases, they have to go in and surgically carve out the dead meat. And some people never get their full strength back. It's a life-changing event that starts with a whimper in the middle of the night. To get how this nightmare happens, we need to talk about what chronic high blood sugar does to your insides. It's like pouring syrup into a high-performance engine. When diabetes is left to its own devices for years, it fundamentally screws up your blood vessels in a process called endothelial dysfunction. Try saying that after 3 beers. The endothelium is the delicate wallpaper lining the inside of your blood vessels. High glucose levels trash this place. The walls get thick and stiff like old pipes. They become clot-happy and they lose the ability to open up when your muscles need more blood. It's a vascular traffic jam of epic proportions. Here as the leading theory on the diabetic myonecrosis process. Microscopic blood clots start forming in the tiniest blood vessels that feed your muscles. We're not talking about the big clots that cause strokes. We're talking about microscopic plugs, like gravel in a fuel line. When enough of these tiny vessels get blocked, whole sections of muscle get starved of oxygen and nutrients. They basically suffocate and die. And then the vicious cycle begins. The muscle starts dying, and your body's immune system rolls in like a clumsy cleanup crew with bulldozers. The inflammation it causes actually makes the blood flow worse, leading to more tissue death. It's a classic case of the cure being worse than the disease. High glucose levels also make your blood stickier than a movie theater floor. This hypercoagulable state, combined with the already damaged blood vessels, creates the perfect storm for tissue death. The most terrifying part? This can happen in your sleep. You go to bed fine, you wake up with a dead leg. Diabetes is one hell of an alarm clock. Who gets to join this exclusive club? Diabetic myonecrosis isn't for diabetes newbies. It's a complication for veterans. It targets a very specific group with a clear set of risk factors. You basically need a long history of treating your diabetes like a mild suggestion. The average patient has had diabetes for 15 to 18 years, with blood sugar levels that have been consistently in the yikes zone. Their HbA1c is usually over 9% and often in the teens, like our friend Marcus. It's a slight diva, affecting women a bit more than men. The average age is between 37 and 44, but it's been known to show up in younger and older folks. Crucially, myonecrosis rarely crashes the party alone. About 75% of the time, it brings friends. Diabetic nephropathy, kidney damage, retinopathy, eye damage, and neuropathy, nerve damage. This tells us that myonecrosis is a sign that the diabetes has already done significant damage to the VIP organs. If your kidneys are already complaining, your muscles might be next. If you're on dialysis, your risk is even higher. Other red flags include a history of heart disease, stroke, or, in some case, reports, substance use that further punishes your blood vessels, like cocaine. It's a complication for people who are already playing with fire. Recognizing the warning signs of this rare diabetes problem is tricky because it's such a great impersonator. But there are some red flags you can't ignore. The number one symptom is sudden, severe muscle pain with no damn reason. You didn't fall. You didn't run a marathon. It's just there. This isn't a gradual soreness. It's an intense, deep pain that feels like it's coming from the bone, often showing up overnight. The pain comes with a side of swelling that's impossible to miss. We're talking a visibly larger limb. The skin over it might get tight and shiny. But here's the weird part. It usually isn't warm or red like an infection. It's just huge and painful. Moving the affected limb becomes an exercise in agony. You can't walk on it. You can't lift with it. And your trusty bottle of ibuprofen? It's about as useful as a screen door on a submarine. This pain needs the heavy artillery. The absence of other symptoms is a clue for doctors. No fever, no trauma history. This often leads to a wild goose chase and delayed diagnosis while your muscle is turning to mush. Figuring out if it's diabetic myonecrosis is a puzzle. Blood tests might show elevated muscle enzymes like creatine kinase, which is a sign of muscle damage. But if you test too early or too late, these levels can be normal, adding to the confusion. The MVP of diagnosis is the MRI. This magical machine can show the classic pattern of muscle swelling and tissue death. It lights up the damaged areas like a Christmas tree. In some stubborn cases, they might go for a muscle biopsy, taking a little chunk of your muscle to look at under a microscope. The tissue will clearly show dead muscle fibers and those telltale damaged small blood vessels. The key is that someone on your medical team has to have the imagination to consider this rare diabetic condition in the first place. If you're a diabetic with sudden leg pain and swelling, you might have to be your own advocate. Don't be afraid to say, "Hey, doc, I read about this thing called diabetic myonecrosis. Could it be that?" You might just blow their mind. Treating this beast is a lesson in frustration. The body can often heal itself with support, but there's no magic pill that brings dead muscle back to life. You can't uncook the steak. The single most important thing is to get your blood sugar under control. If your HbA1c is in the stratosphere, you need an intensive insulin therapy plan to bring it down to earth. This is non-negotiable. The second most important thing, for the love of God, rest. I mean full-on couch potato mode. This is where people mess up. Your instinct is to move it, stretch it, walk it off. With myonecrosis, that's like throwing gasoline on a fire. You must let the muscle completely alone. No weight-bearing. No physical therapy until the acute phase is over. Pain management is a huge part of this, and it usually requires prescription-strength meds. But doctors have to be careful because many patients also have kidney issues, so common NSAIDs are off the table. Many patients are put on low-dose aspirin or other antiplatelet drugs to try to prevent those microscopic clots from forming. In some edge cases, doctors have tried corticosteroids to calm the inflammation, with mixed results. Surgery? That's a last resort. Cutting out the dead tissue sounds logical, but studies show it actually leads to longer recovery times and a higher chance of this crap happening again. The best medicine is often patience and supportive care, as boring as that sounds. Let's get real about the outcomes because this isn't a fairy tale. Diabetic myonecrosis has a nasty habit of coming back for seconds. The recurrence rate is brutally high. Between 35% and 48% of patients get another episode, usually in the other leg, within 6 months to 2 years. Recovery is a slow, tedious grind. You might see improvement in a few weeks, but getting back to normal can take months. Some people never get all their strength and function back. They're left with a permanent reminder of what unchecked diabetes can do. The overall prognosis is grim, because this condition usually shows up in people who are already in the advanced stages of diabetic complications. These individuals are at high risk for the big ones: heart attack, stroke, kidney failure. The diagnosis of myonecrosis is often a sign that the body is breaking down in a major way. Even after the pain fades, the psychological scar remains. The anxiety and depression that come with suddenly losing the use of a limb and the constant fear of it happening again are a heavy burden to carry. Don't let this happen to you. Given the nightmare scenario we've just described, prevention isn't just a good idea. It's everything. The good news is, you have a hell of a lot of control here. The number one, absolute, most critical thing you can do is control your blood sugar. Keep that HbA1c below 7%. Every point you lower it dramatically reduces your risk of this and every other complication. This is the main event. Be a nag about your health monitoring. Regular blood sugar checks, HbA1c tests every 3 months if you're not controlled, annual eye exams, kidney function tests. Be proactive, catch problems when they're small and fixable, get your blood pressure under control. High BP accelerates blood vessel damage. Target that 130/80. Manage your cholesterol. Statins aren't just for your grandpa, they're a shield for your vessels. If you smoke, for crying out loud, stop. Smoking and diabetes are a partnership from hell that fast-tracks you to Complicationsville. Exercise is crucial, but if you've had myonecrosis before, you need a carefully supervised plan. And take your damn medications as prescribed. This isn't the time to get creative with your dosage. This is not a solo mission. You need a crew, an endocrinologist, a primary care doc, a podiatrist, an ophthalmologist. Build your healthcare Avengers. Be honest with them about your struggles. If your numbers are bad, don't hide it. Address it. If you're reading this and seeing red flags in your own life, it's time for a come-to-Jesus meeting with yourself. When was your last A1C? What was the number? If it's been over 3 months or your result was above 7%, you need to have a serious talk with your doctor about ramping up your treatment. Know the damn warning signs. Sudden, severe muscle pain in your thigh with no cause? Don't wait and see. Get to a doctor and mention diabetic myonecrosis. You might have to educate them. Be your own best advocate. The bottom line, diabetic myonecrosis might be rare, but it's a brutal warning shot. It's what happens after years of uncontrolled diabetes have turned your blood vessels into a crumbling infrastructure. It's a sign that significant damage has already been done to your eyes, kidneys, and nerves. But here's the empowering part. This is almost entirely preventable. It's a consequence of long-term neglect, not bad luck. The tools to prevent it, effective medications, continuous glucose monitors, insulin pumps, lifestyle changes, are better than they've ever been. The time to get serious about diabetes management is today, not when you wake up with a leg that's decided to quit on you. Every day of good control is a brick in the wall protecting you from these devastating complications. Even if you already have complications, tightening your control can slow or stop the progression. It's never too late to start fighting back. Stay informed, stay proactive, and for the sake of your legs, keep an eye on your blood sugar. And if this video didn't scare the bejesus out of you enough to finally schedule that doctor's appointment, I don't know what will. Do me a solid, will ya? If you got a single useful or terrifying piece of information out of this, hit that like button like it's the last dose of insulin in the apocalypse. It tells the YouTube algorithm that this is quality nightmare fuel, and it helps other people find this important info. I want to hear from you in the comments. Ever had a weird diabetes complication that made your doctor scratch their head? Think your leg is plotting against you? Let's commiserate down below. Misery loves company, and so does my analytics. And finally, if you haven't already, subscribe to the channel and ring that notification bell. It's free, and it means you'll get notified when I drop new videos that help you navigate this circus of adulting with a chronic condition. Consider it a public service announcement with more swearing. Thanks for watching. Now go drink a glass of water. I mean it.